Okay, welcome everyone, and thank you for joining us. My name is Shravanti Reddy. I'm an evaluation specialist at UN Women and one of the co-conveners of the UNEG Humanitarian Evaluation Interest Group that is hosting this, this event today. I apologize because there's an issue with my Zoom camera, and so I'm not able to show myself, but hopefully everybody can hear me very clearly. So we're waiting for people to still join, and we wanted to start today by taking a few minutes to do a quick poll. We have two questions. What are your expectations from this session? It would be great to understand and know what those are. And also to find out if you're familiar with one of the methods that we're planning to discuss today. And you can click all of those that are applied. And I believe we will be able to see sort of the results in real time here. So please take a few minutes and fill out the poll. So it looks like the majority, or 92% of us, are really looking to learn something new today. A few have some experience to share or want to know more about humanitarian evaluations. About 18% of us really want to engage with other practitioners. And I think when we see what methods, majority seem to 52% of us are not familiar with any of these methods, so that's really interesting. So hopefully you'll be learning about 3 new methods today. It seems that about 30% of us are familiar with citizen-generated data and big data, so that's great. Social listening data, only 10% of us are familiar with that, so that will be new to the majority of us that are connected today. Okay, so I think we can stop and share the results of the poll. Okay, well, some of you can still continue to complete the poll. But I think we wanted to, we can go ahead and start the session now. You know, we decided to, first of all, I wanted to introduce you to the team. So this event was put together by a group of people in The Hague. You can see that we're representing many different agencies here, and I've listed the names here, as well as we really wanted to thank also the UNEG Evaluation Practice Exchange team. The colleagues there have really been instrumental in helping us to put together this event for you today. So I just wanted to take a moment to acknowledge them before we sort of move on to into the event. Okay, so I wanted to just spend a few minutes before we go to the presentations, just to discuss about or share with you why we decided to focus this session on possible new methods that we could use in evaluation. It's really because at the moment, all of us that are working in evaluation are restricted in making use of several of the traditional methods we've come to rely on given the COVID-19 pandemic. So things like site visits or in-person interviews or observations are really in many cases no longer possible given the travel restrictions, the social distancing guidelines that we have to follow, and as well as overall like ethical concerns. When we speak about humanitarian evaluations, They also often face many additional challenges anyways, given the uncertain environments in which they are conducted in general. But now, you know, these specific types of evaluations are then faced with sort of a double humanitarian context that COVID-19 has created, and that creates new challenges. So while we've kind of all sort of tried to find ways to work around some of these challenges, you know, by using Zoom or doing, you know, remote interviews, you know, we kind of thought it's perhaps time to also look at what are some new methods that we can add to our toolbox that can help us to meet this double humanitarian challenge that we're facing, but also can really help strengthen and expand the toolbox that we use in general. So in looking for new methods, we've also gone outside sort of the traditional evaluation community to see what data collection methods are being used in other functions, and to see if and how we could adapt them for use in evaluation. So the presentations that you'll hear today, it's really, you know, the presenters they'll present the method and its use in humanitarian context or in evaluation. They'll talk about what might be the practical implications for its use in different kinds of humanitarian evaluation contexts, or just humanitarian context. They'll also touch a bit on what are the challenges or ethical issues for humanitarian evaluations, for the use of those methods in humanitarian evaluations. And also, you know, overall, we just want to consider what's the medium-term or long-term feasibility of adapting the method for practical use in humanitarian evaluations. So we have three methods that we're going to present today, and I just want to quickly introduce the four presenters that we have. Our first presentation will be on social listening methods, and we're lucky to be joined today by two colleagues from UNICEF. First, Angus Thompson. He is a senior social scientist in the health section of UNICEF, focusing on demand for vaccines. He's also an adjunct clinical professor at the Department of Communication Studies and Global Health Communication Center at Indiana University. He is currently developing a global social listening and engagement program that aims to understand and address misinformation and concerns related to COVID-19 and immunization programs. We also will hear from Sylvia Somariva. She is a consultant at UNICEF's Eastern and Southern African Regional Office and the Communication for Development section. Her work focuses on digital social listening, rumor tracking, and infodemic management to inform risk communication and community engagement strategies in the COVID-19 response. She also is a PhD candidate in public health at the University of South Florida. Following that, we will hear about citizen-generated data methods, and we have the pleasure of hearing from Rebecca Firth. Rebecca is the Director of Community and Partnerships at the Humanitarian OpenStreetMap team, or HOT. Rebecca works to improve HOT's capabilities to provide long-term capacity building on OpenStreetMap communities through training and microgrants, and also grow its use amongst NGOs, and also to share HOT's message globally with new volunteers and partners. Previous to working at HOT, she was a digital and innovation consulting in digital innovation and consulting field. She holds a master's degree in geography from the University of Cambridge, where she focused on international development. And last but not least, our final speaker is Michael Bamberg, who will present on big data methods. Michael has a PhD in sociology and has been involved for over 40 years in the evaluation of international development programs. Over the past few years, he has worked on the opportunities and challenges for integrating new information technology into the evaluation of development programs. So we will follow each of these three presentations with a short Q&A of about 5 minutes, where you will have the opportunity as participants to have your questions on the methods answered by the presenters. We ask you to please write those questions in the chat, where my colleague Diana will be gathering them, and she will pose as many as possible in the 5 minutes that we have before we move on to the next presenter. And then just so you understand the format. Following the final presentation and Q&A with Michael on big data, we will then move into 15-minute breakout rooms, and we'll explain how to transition to those rooms and the format after the last presentation. So I'd like to hand over to Angus so he can share with us his work on social listening.
Thank you kindly. Hopefully that's visible. How do you do, everybody? Hi from France, land of lockdown. I hope you're all well and staying safe. Thank you kindly for the invitation. Sylvia and I are going to share this next 10 minutes, so I'll move fairly quickly. I think I'll come at this, the topic of social listening with a more high level or global perspective, as Sylvia kindly put it. And then Sylvia will give you a more concrete operational perspective on how you might apply social listening. A proviso is that I have no experience in humanitarian evaluation, so my focus has been immunization, vaccine decision-making, the social and cognitive determinants of that. As you heard, we're currently focused on developing the tools, resources, support that countries would need to implement the kind of program that Sylvia will illustrate in more detail. So what I wanted to do really was leave you with a few key principles rather than getting into the weeds today, and then hand over to Sylvia. This project, just two key principles here is we have three big chunks that we're developing. We're developing a platform for social listening and analytics. This is essentially a big data approach, and I'll come back to this in a second. We're developing a learning academy because these are skills that are often not lacking, but not common. And in fact, to be doing the kind of work that Sylvia is doing is, as a colleague at CDC says, almost a unicorn position. You need many different hats that you're able to put on and take off. And the third piece of this, and this is going beyond social listening to engagement in digital channels, is we're developing a digital interventions and assessment lab, which will design and rapid test content, so really using the platforms to help us rapid test content to make sure that it is well fashioned, well tailored for the audiences. These are collaborations with the public good projects, First Draft, Experts in Misinformation, and the Yale Institute for Global Health. So the first principle of social listening that I'd like to leave you with is that it's not social media listening. So it should be considered social listening. And the tools that we have available now that you might call big data allow us to imagine plugging in any data source that we have out there. And this is important because this potentially allows us to bridge that data equity gap, which happens with a lot of social media listening, where we're only listening in to the people who are speaking on their smartphones, basically, like, in a nutshell. So we can access a lot of media through media monitoring. Most of that, a lot of that is online. We can access a lot of the classic online media, the major platforms, the Twitters, which, well, don't really matter much in the countries we're in, but their API is open, so everybody loves Twitter, but Facebook and the other platforms. But there are a lot of other novel digital sources. At UNICEF, we have Europort, which is both a push and pull system that allows us to reach demographics that we might not otherwise get to. There are other chatbots, there are other sources there. But most importantly, there's also what I might call analog data, real world data we're picking up through surveys, polls, behavioral insight studies, but also like community feedback. So the idea is that if you build the system right, and this is what we're working towards, you can aggregate all of this data, you can design and develop powerful algorithms that will allow you to make sense of that data. So you can essentially have millions of ears and a very, very big brain to make sense of that, so that you can start to pull the signals out of the noise, make sense of those signals, understand them, and then think about what the appropriate actions are thereafter. So that's my first point. And I'm going to have to move fast, folks, because we only got 5 minutes. My second point, and I'd just like you to focus on the top line there, is that everything has to be joined up. Sylvia will show you a similar slide to this. I wanted to repeat this because this is so important. Social listening is useless if it's not linked with a really solid level of analytics, understanding, in our case, verifying misinformation, assessing the impact of that misinformation, understanding where it's circulating, whether it's getting traction, and then developing actionable insights that we can provide to the folks on the ground. And that obviously is the link with the engagement, the strategic engagement, the RCCE, comms, etc., and the monitoring and evaluation. And so this actually should operate in a cycle. And one of the big gaps that we often have is that these are not coupled together. So the reports land in different places, but not in the right place, or the listening is never really heard, or the engagement is not informed by all of that, etc. My last point, and then I'll hand over to Sylvia, is social listening allows you to pick up those signals. These are signals that we picked up. This is a signal we picked up only a few days ago. We're focused in West Africa at the moment. This is happening outside West Africa, but it's about polio vaccine that is a concern, that is a topic of interest for us. And we know that these kinds of things can get traction very rapidly across different countries. You can pick up signals and characterize them, but you can also use the insights that you're getting from your social listening to reverse engineer the content, the interventions that you develop. So this is an example. This was done very quickly. We're really just kicking this off, but we went in and looked in the countries where we're operating, Burkina Faso, Cote d'Ivoire, and we started to say, we were able to say, where are the conversations happening in those channels? What is the kind of content that's being shared? What would be culturally appropriate? What is appropriate to the different communities that are having those conversations, and reverse engineer the content that we develop, so that we know that when we do disseminate it, that it's well adapted for people, for the people that we want to reach. So those three principles, you can listen to anything, and that allows you to bridge that data equity gap. It has to be strategic. Everything has to be joined up. Social listening that doesn't connect with analytics, that doesn't connect with the engagement, doesn't make sense. And you can be learning a lot of things through social listening. And I obviously haven't touched M&E here, but those are the points that I wanted to leave you with today. Sylvia, over to you.
Thank you, Angus. Thank you so much for for that overview. And you will see that the work that I'm going to present on very quickly is very much complementary and aligned with what Angus has shared. And this is, of course, not by chance, but we are trying to build a system that works, across our different regions. So specifically, I'd like to focus my remarks on digital social listening, which is specifically what I'm working on, and which is clearly just a part of social listening more broadly. We do try to have an approach that bridges the digital and non-digital space. Some of the channels that Angus mentioned, like QReport or Internet of Good Things, are clearly in that strategy. But my work specifically is more on the digital side. And I share our experiences at Eastern and Southern Africa Regional Office. We work with 21 countries in the region to support them with social listening and rumor management as well. So as you know, UNICEF has quite a strong and long-standing experience working with communities, engaging in community feedback mechanism throughout our region. So there is a pretty strong capacity already in terms of social listening, what we would say offline or on the ground. And so since the beginning of the COVID response in Eastern and Southern Africa, we worked on integrating this existing capacity with additional social listening on digital platforms to sort of integrate. Of course, rumors, concerns are circulating offline a lot. Internet penetration and use of social media is not necessarily high in all of the countries in our region, but it's certainly a component. And as Angus was mentioning, some of the rumors that are originating from other regions, they end up appearing in our countries as well, and they end up also being discussed offline. There are leaders that are asked questions about things that people have read online. So definitely this is a key component. So what we did was we set up a strategy to monitor online conversation where we wanted to know what were people's questions, concerns, rumors around COVID, specifically those pieces of information that were potentially likely to affect access to services or other outcomes that we're really looking at within our work. And what we also wanted to do was to provide some technical support to country offices on rumor tracking and management, how to frame response to rumors, how to address some of these issues, because of course there was already work ongoing in the region and we wanted to reinforce those existing capacity. So the framework we adopted, you can see it's 3 major blocks, very much basically in line with what Angus presented earlier. Definitely, we set up a series of tools to monitor the online discourse on digital news and social media. We just ran periodic search strings with keywords to track information on COVID, on specific subtopics. And we use a different range of news gathering tools. We have actually we have a contract with one platform, and then we also use a lot of free tools that are actually pretty good quality. And so we gather any sort of concern or rumor that we can find on COVID in the region that's circulating in our region, and we insert that information in a dashboard. We have I'm going to show you just a quick snapshot in the next slide, but it's a regional dashboard where we sort of try to summarize and categorize some of these concerns and questions and search trends so that it can be informative of the work of country offices. We also produce periodic reports, and of course there is a lot of work in trying to make sure the reports are as much as informative of decision making, because as mentioned, we don't want to just produce data that are difficult to to use for country offices. And then finally, the last mile is trying to adjust and engage users with the content. And so how our country office is using content, the insights from social listening to inform content development. And so we actually ran a survey in the region to see how country offices were using these insights. And we found that they are using it to decide what to push on social media, when to share certain piece of content, and how to adjust content that's existing to sort of address concerns and questions. And so this is just quickly to show you a part of our dashboard, the regional dashboard, where we log some of the information that we track through social listening. There are actually a few other sections where we track data from other channels, Europort, IOGT, on COVID perceptions, myths, other beliefs. We try to have basically a one place location. It's still under development, but the idea is to have a place where country offices can go and look at this data together and hopefully triangulate the data to inform their communication strategy. So I'll stop here, but thank you again so much. And I really look forward to the discussion and the questions.
Okay, Thank you so much, Sylvia and Angus. This is really interesting work, and it's new to the majority of us that are online, including myself. So I'm seeing different questions in the chat. So I really want to hand over to Diana so that she can pose some of these questions that are coming from the participants.
Thank you. Thank you, Shavanti, for handing over. Just the first question that I got, which was sent to me, was if you could define social listening, and particularly, Sylvia, you mentioned that you're focusing on this digital social listening. Could you talk a little bit more about what other types that UNICEF has used, whether in COVID or prior to COVID? Thank you. And then I'll move on to the other questions. Actually, yeah. Maybe, sorry, Sylvia, potentially, let me just get in another question. So I'll just put two for you at the moment. There was another question that was asked about how to ensure privacy and confidentiality when using social listening. Thank you.
Thank you. Thank you so much, Diana. Yeah, those are really, really good questions. So in terms of the definition, what we define as social listening is the process of gathering feedback and inputs from different communities. So, we could be talking about online communities, we could talk about individual users, we can talk also about members of a network with work. We in UNICEF SRO, we work closely with the religious leaders, for instance, or other leaders. So also collecting feedback from them on what are the concerns and the questions they have on certain issues. And And it's in terms of exactly what it means in practice, we are looking, for instance, on digital, we look at search trends. What are people searching on search engines? We look at posts or articles that are being shared widely. What are the concerns? What are the questions that these articles are addressing? Or if there are rumors and pieces of misinformation, what is the false information that's circulating, and how is this affecting and impacting the response? So those are kind of some of the categories of things we're looking at. But also, you could also consider looking at social media mentions on your own accounts, or if you have organizational accounts. People oftentimes will, you will post something and then people will comment about something else. And so that gives you a sense of where people are going, what is the interest. So it's a bit of a qualitative work in a sense, and sort of insight extraction is sort of a developing, ongoing work. And I don't think there is a perfect recipe for this yet. The other question, I think, yeah, that's really on the privacy issue and confidentiality. That's a really key issue, I think. So the work we are doing in terms of social listening reports and the dashboard is shared internally, but we also don't share, like in the dashboard, you will not find links to private information of the people who shared the rumors, or on any sort of issues related to that, because of course we're also very cognizant that we don't want to stigmatize people for sharing misinformation, and there are actually fake news laws in some countries, so we are very much aware of that challenge as well, sort of that context where we need to be very much ensuring privacy of individual users, particularly because most times misinformation is shared by people who don't know they're sharing it. It's a different ballgame when you're talking about a concerted action of disinformation actors who are trying to deceive. It's a disinformation campaign, then it's different. But in many cases, what we are seeing in the region is just users, sharing something because they've seen it and they think it's true, but they're not really looking to harm anyone, so sort of to speak.
Thank you so much. I think we have time for one more question, and also Angus, if you wanted to jump in as well and respond on anything before we move to the next presenter.
I think just a higher level view of the idea of the importance of privacy. The tools that we use are primarily accessing either anonymized data, search trends, etc., or data that's in the public domain. So, when we dive in and drill down to a specific, Twitter conversation, that data that we're viewing is in the public domain. So, I think it's an important issue. I think as we build out the global program, we want to bring on board an ethicist to help us work through some of this. But, a lot of the monitoring of those big channels, the big social media channels, is of anonymized data. Somebody asked about the tools we use, and so I presented a tool that we're developing, which we hope will be a kind of bespoke but customized tool for countries, because we saw real gaps in the commercially available tools. But for example, Sylvia is using a commercial service called Talkwalker that allows you to access a number of data channels, certainly, many of the primary kind of social media platforms, some media as well, get search terms, etc. So it's a commercial service that does a lot of the hard work for you, aggregates the data and sorts it into a visual dashboard that we can work with help from Talkwalker to configure that, to refine that, to adjust that over time. There are some simple tools that you can use for free. Google search trends is, if you look that up, Google Trends, sorry, you can start looking at what people are searching for, what kind of volume there is out there. Even just Google Alerts, setting a few keywords, it's amazing how much that picks up, especially in news. It's phenomenal how much I pick up from that. So there are many tools out there, and the key really is to understand first, what are the data, where are the conversations that you want to listen into, where are they happening, and kind of work backwards from that to the appropriate tools that would allow you to listen into those conversations, rather than, for example, embarking with a talk walker and setting things up to track Twitter, and then finding out that nobody's actually using Twitter in the country that you're interested in. Over.
Thank you, Thomas. I think we have to move on, and thank you for answering one of the questions that was put on the board. We have taken note of these questions, and we'll see to what degree some of these can be answered potentially later and also during the breakout room. Shravanti, over to you.
Okay, yes, thank you. Thank you, Diana and Angus and Sylvia. I see there are still lots of questions, and just to let participants know that you'll have an opportunity to further interact in the breakout rooms, and also at the end we'll have a plenary where you'll have an opportunity to ask some additional questions if those weren't answered already. I'd really like to hand over now to Rebecca from HOT, and so she can tell us about her work in citizen-generated data.
Thanks very much. Hi everyone, nice to be speaking to you today. I'm going to share a few slides on HOT's work in citizen-generated data, and then one of my colleagues, Lauren from our M&E team, is also around to support with a bit of extra info too. I'm just sharing my screen right now. Would someone be able to just give me a shout out? Are you able to see my slides?
Yes, we are.
We can see it, yes.
Great. So Humanitarian OpenStreetMap team is an organization that's been working in citizen-generated data for around 10 years. Citizen-generated data is kind of a relatively new term in terms of its usage within the data community, but something we've been really involved in trying to set some sort of standards and guidelines around. So the goal of Humanitarian OpenStreetMap team, also known as HOT, which is the organization I work with, is to map an area home to 1 billion people. So I'm going to go through and share a couple of examples on what does that look like, what's an example of the kind of impact it leads to, and of course happy to answer people's questions. So the first thing to mention with citizen-generated data is obviously the contributors of that data are the core to the organization. So HOT's a community of contributors, an open source and open data community. And those contributors can be based anywhere in the world. And I'll show you a little bit of what they produce depending on what location they would be in.
Sorry,
and
Rebecca.
our mission,
we
yeah?
still see the first slide. And yeah.
Give me just one moment. Let me reshare again. Can you now see a different slide?
Second, it's just a black screen. Okay,
oh.
there it is. Yeah, now it says HOT as a community. Yeah.
And I just moved on. Can you see another slide now as well? Can you see a different slide now?
Yes, vision.
Yeah.
Yes.
Perfect.
Thank you.
Yeah, the vision is to map an area home to 1 billion people who are living in poverty and at high risk of disaster. So far, we've mapped an area home to about 150 million people. So we're about 15% of the way towards that target, which we hope to reach by 2025. The goal of HOT is to make sure that everyone is counted, so everyone is included on the map. So a lot of this kind of feeds into a lot of Leave No One Behind initiatives and last mile programs. That map data is accessible and used in decisions. So that piece is definitely around kind of working with humanitarian partners, with NGOs. We're an H2H humanitarian to humanitarian organization. So the impact of the maps is often delivered via partners implementing on the ground, and that everyone can engage and contribute to the map. So how can we democratize the process of mapping and make it easy for anyone anywhere to add anything? Because obviously the ways in which maps are created right now are usually pretty colonial, pretty sort of people coming from outside to map an area, mapping specific things that they might think are important, but perhaps not representing things that the community think are important, like different place names in different cultural, different languages, or place names which might be important to different cultures. This is just a quick example of some of the maps that usually exist for places before we start working. So huge variation here from kind of sometimes no map to you'll find kind of some organization who've drawn something to help them orient themselves in their work in a location. And our process is pretty simple. We have a remote stage on the left-hand side of the screen. That's the first 2 stages. These happen remotely and anyone anywhere can do them. So far we've had about 250,000 contributors. The area that we need to map is split into lots of little squares, and each of those little squares is a small piece of satellite imagery, and a volunteer will just draw buildings and roads on top of that satellite imagery. So you can see that in the GIF there. So very simple, and anyone with an internet connection can contribute. Second phase happens in the location that we're mapping. So a local mapper using a smartphone, a very basic kind of Android phone, can work on or offline to tag additional pieces of information on that map. So for example, adding the name of a road, adding a village name, identifying a particular point of interest, like a school, for example. In the past 10 years, we've had about 270,000 volunteers and about 50,000 plus downloads annually from HDX, and mapped an area home to 150 million people. And the impact model that structures our work is kind of very, I won't go through this in detail just because of time. But you know, we spend our time on mapping, training, capacity building, providing open source technology, strengthening, connecting and diversifying the communities that are mapping. We really believe that who makes the map makes a big difference to what is actually mapped, and ensuring that there's local ownership and sustainability over those maps. So they're the kind of key activities that we focus on. A couple of examples now. I'm just going to share some disaster and healthcare case studies to try to contextualize this. One of these is related to Cyclone Idai, where just over 500,000 map edits by 4,500 volunteers were used by Médecins Sans Frontières to provide cholera vaccinations, and by the International Federation of the Red Cross to prioritize relief operations. And also Hurricane Maria, another strong example where maps were used to understand where there were blackouts and lack of electricity access, where road damage was cutting off different populations, and using the building footprints to provide funds to people whose homes were damaged. And it really is quite a sort of foundational shift from how disaster response used to happen, where you know, there wouldn't be the kind of the expectation that this huge crowd of like 4,000 volunteers online could jump in and within a couple of days provide the information that's needed for disaster response, which is a really kind of wonderful thing that we now have. But what we're really focusing on is how do we make sure that those volunteers are mapping places before that they're in crisis, so that that kind of time lag to get maps in disaster response is reduced to 0. And all these maps are completely open source and openly available for anyone to update or use. Now, another couple of examples around healthcare, and I'm just conscious of time actually, so I'm going to skip to just one detailed example and then hand over to my colleague Lauren. So the value of a map for fieldwork, and this is a really, really basic example around vaccinations, which I thought might be particularly relevant considering how so many people right now are talking about COVID vaccinations and sort of how that could possibly be rolled out on a global level. So this is an example of an area in Chad where we were supporting Médecins Sans Frontières with a measles vaccination campaign. On the left-hand side of the screen, you can see the map that they were using. And on the right-hand side of the screen, you can see the map that we created in OpenStreetMap. So the first thing to note is that north was in the wrong direction on the map that they were using. So you can see this Idata city in the middle was kind of that the roads were sort of misoriented. So firstly, north wasn't in the right place. Secondly, there's lots of other settlements that were being missed out of this main map. So there was loads and loads of places for this vaccination campaign that needed to be visited. There was so many things that a map can help with in this regard. Firstly, getting to the right people for vaccinations, but then also ensuring that success is properly evaluated. Also making sure that community buy-in is secured and reaching kind of local people in advance, and making sure that they know to sort of expect this campaign. And making sure that the supply chain can be maintained. Obviously, supply chains are problematic for many things in rural areas, but obviously, if you need to keep a vaccination cold, then logistics planning can be really challenging. So the map helps you to understand kind of where will you be able to transport things and what sort of planning do you need to do. I'm just going to hand over to my colleague Lauren for a couple of slides now. Lauren, can you hear me?
Yeah, I've got you. Thanks, Rebecca. So just very quickly reflecting back on the questions in this webinar. So what are the practical implications for use of this methodology? So as mentioned before, doing real-time evaluations, RTRs and humanitarians are limited. So this really provides a bit more of a common operating picture for all humanitarian response at every level. It also makes sure that targeted populations have already invested in contributing to this platform. So in that sense, increases accountability within the evaluation process and really aligns with the open source data ethos and principles that many evaluations haven't really incorporated in the past. And as HOT volunteers and capacity is already embedded in the communities, it means evaluations can then piggyback on that GIS capacity that's already in existence. And then because, again, our volunteers are there, it improves access to longitudinal data when it comes to GIS and mapping as well. On the next slide, in terms of challenges and ethical issues, really understanding the social change or perception and complexities in gender dynamics still remains. So this methodology in OSM would perhaps work in tandem with other analytics that you do at the beginning of humanitarian response, and combining that may be an interesting discussion in the breakout groups. Privacy and data protection, collecting sensitive data, again, something that maybe warrants further discussion, but we do have lots of data control and data quality methods and data teams to manage that. And then I think just monitoring the real time of this data as well is something that we're working with, but may remain a challenge when it comes to quick and fast humanitarian response. And then finally, in terms of medium and long-term feasibility, again, I think coming back to the localization agenda, because we're capacity strengthening on GIS and other open mapping, we're improving local partners' ability to evaluate the responses, perhaps even independently of global or HQ teams. And again, just bringing it back to having that operational platform where different levels of the humanitarian response can be using the same data in real time. And then finally, coming back to just synergies between planning, so at HQ level, country level, regional level, using the same platform and increases ownership at the local level. So that's it from me. Thanks, Rebecca.
Thank you. Thank you, Rebecca. Thank you, Lauren. We have received a few questions, and if you don't mind, I'll pose all four of them and see what you can answer. The first question is to understand whether you're able to compare maps over a period of time. For instance, looking at one village now and potentially 5 years later to see what the changes are. We also have a question as to how do you verify the validity of the information that's been provided in the different maps? there was a question about motivation of local communities and how do you encourage them to provide the necessary inputs within the process. And finally, if you've also been able to map rural areas and agricultural infrastructures within your work. Thank you.
Thanks, Diana. Do we have time to go over all of those now, or should we wait? What's your preference?
Shravanti, I think why don't do you want to take a couple of them? Shravanti, are we okay on time?
We're a little behind, but I think it's useful to just have some response to those questions. Perfect. And then whatever we can't, just so you know, we have the 15 minutes of breakout room, so you can expand on some of the things there.
Mm-hmm. Fabulous. Okay, I can take a quick whiz through some of them then, but apologies if these are quite light touch answers. So the first one around comparing data over time. I've just put in a link here to a site that enables you to do that and to see sort of when different things were added to the map. Obviously, that is a really interesting thing to measure for a variety of different reasons, but feeds very strongly into, say, some of the SDG indicators and things like that. In terms of verifying the validity of information provided to the map, as you kind of will have heard in the presentation, the way we work is quite similar actually to kind of Wikipedia and other open source repositories where kind of anyone can edit, anyone can update, but the important thing is having a really strong review process. So I don't know if you've ever tried to add anything to Wikipedia, but it's really, really hard. Our barrier to entry is lower because we're really focusing on increasing accessibility. So we do have validation processes which happen after something has been added. So essentially someone adds something to the map and then that will flag for other people who are more experienced to validate with sort of stage gates. So for example, in order to validate someone else's information, you have to reach a certain level of expertise yourself. In terms of local information, obviously it can be quite challenging to validate local information unless you have another volunteer also in that area. Instead of kind of erasing local information, we favor the approach of tagging kind of alternate options because we want to recognize the fact that kind of many different truths can exist in one place. So for example, you may find a location that has, the place name that the government gave it, the place name that the previous government gave it, the place name in different kind of languages. And it's important to make sure that all that information is captured so that, for example, if you're trying to do something like contact tracing, you are able to actually sort of understand where people are in their own words rather than where they are according to, sort of like a kind of a government map, for example. And in terms of motivating local communities to input, this is something that we work really actively on. We have we work quite a lot with sort of open source and open data communities that exist already in most of the countries that we're working in to sort of establish mapping communities. Our goal is to work in 94 countries and we have existing mapping communities in 53 of those. And we do a sort of community support program where we provide different support and micro grants and funding and training to communities in order to firstly get started and secondly kind of evolve. But one thing worth noting is loads of people contribute to OpenStreetMap completely independently of HOD. It has kind of 4 million users globally. It's a big kind of movement that we are fortunate to be able to sort of play a role in ensuring that places that are within our mission also get represented in that movement. But it is a huge movement of mappers existing in every country in the world. Around next question, active conflict situations. Yeah, this is a really tough question. We have a different kind of quite a complex way of approaching this, so I'm going to provide a bit of a crude summary, just conscious of time. But There have been circumstances when we've chosen not to map something because we felt that the risk outweighed the benefit. The scenario where that would happen would be an active conflict where location is the sensitive thing. What is represented on a map is something that you can see when you walk down a street. So it's not sensitive information. I mean, it is possible to collect sensitive information at the same time as mapping and to store that in a private way. But the information that's going to be public on openstreetmap.org is always going to be information you can see with the naked eye. And so it's about sort of understanding, like, is the location of this community something that a potential conflict might not actually know about? And if so, then you have, you know, a duty to protect that. Yeah, the examples of where that's happened, for example, we received a request to map, we do all our mapping based on requests. So communities, UN agencies, governments, NGOs, anyone can request us to map an area. So the validity of that request is quite important, because obviously the request is a known benefit for that community. We want to map this place so that we can do kind of this action. So we're sort of weighing like a known benefit against a potential threat. And so it's just important to kind of weigh how big is that benefit against the possibility of this being used for harm. There aren't any known examples presently of maps being used for harm because of going back to that previous point around the fact that anything that's on a map is something you could physically see with the naked eye. So I'll stop there just because of the timing, and thanks very much for listening.
Thank you, Rebecca. Thank you. I know we have a couple questions, but we'll put those aside for now, and hopefully they can be touched upon in the breakout. Over to you, Shravanti.
Thank you, Diana. And thank you so much, Rebecca. This was, and Lauren, this was really interesting. And we're starting to see some connections actually between the different methods. And I think with the third one, we'll see that as well. I know there were a lot of questions. You can also continue, hopefully Rebecca and Lauren can also respond to those in the chat. And I think Angus and Sylvia were doing the same since we have some limited time during the actual session. So I'd like to hand over to Michael so he could talk to us about his big data work.
So hello, everyone. Just try and set up my share screen. Okay, so hello and welcome from around the world. I'm just going to be talking briefly, trying to give an overview of some of the ways that big data is being used for humanitarian programs. And I'm going to provide one specific example. And some of the material I'll be presenting comes from an evaluation I'm doing for the UN Global Pulse. They have a program looking at applications of big data in humanitarian programs. So I've been working on that and we'll be drawing on some of that experience. So just to refresh our memories, here are some of the many kinds of big data, a lot of which have already been mentioned, and these are only some examples. We have the top left, the social media, Facebook, Twitter, WhatsApp, all of the other media which you're familiar with. Then we have text analytics, where you take large amounts of data and you use artificial intelligence and data learning to look at patterns in data, which was previously very difficult to do just because of the volumes of data. So text analytics is becoming a very useful tool. Then radio call-in programs, which are particularly important in rural areas which may not have very good access to internet. And I'm going to be giving a brief example from that. And then satellites and drones. This is an example of a Delta. This is a very powerful tool, and already been mentioned. One of the things you can do with satellites is you can get data over long periods of time, sometimes 20 years or more, which is very powerful for looking at long-term trends. Then on the top right, smartphones generate huge amounts of information. And recently, work is starting on looking at the call records from telecom companies. They have records of where calls are made from, where to. They don't have information on the content, but this is being used, for example, to assess the integration of refugees in host countries, where you can look at what percentage of the calls go from refugees to other refugees, what percentage go to people who are citizens, and you can begin to use that to get some indicators of integration or lack of integration. So these are just a few of the many methods of big data. Some of the reasons why big data is very attractive for evaluation: it's much faster and cheaper to collect the data. For humanitarian programs, you can get access to remote areas which are either inaccessible physically or high risk. So this is a very, very powerful set of tools. You can also access many new kinds of information, audio-visual information, text, many different kinds of information which were previously very difficult to access on a large scale. You can also cover very large areas geographically and over long periods of time, which is really critical because most evaluations just focus on a small area, focusing directly on the project, just because of the costs of collecting information on wider areas. So this is a very powerful benefit. Critically, also, you can do predictive forward-looking evaluations. One of the big criticisms of most evaluations is they're doing a post-mortem on a program which began maybe 5 years ago. By the time you complete your report, it's so out of date, the relevance may be much less. So with predictive analytics, you can predict what you think would be the effects of different kinds of interventions, and then you can check it in real time. So this becomes a much more powerful management tool. And as we've mentioned, different sorts of information can be collected. They can also be integrated. So just a few quick examples of some of the ways that big data is already being used in humanitarian programs. We've already had a number of examples of the analysis of social conflict, hate speech, and fake news. You can map and predict the growth of refugee settlements, which is really critical because they grow so fast, estimating what are the needs of supplies and equipment and staffing. You can assess the integration of refugees into host countries. You can map population movements following emergencies, and you can help with the location, for example, of rural health centers, schools, logistical centers. So these are just a few of the many ways that big data is already being used. I'd just like very quickly to give one example of using radio call-in programs to track negative comments about refugees that might lead to social unrest. Radio call-in programs are very important in rural areas, certainly in Africa and in other regions as well, because this is a media that people use when you don't have access to internet. So this is just a very quick overview of how you can use big data for analyzing radio call-in programs. In many countries, you may have 500 or more local radio stations, so it's a very powerful tool. So the first thing you have to do is to identify the local radio stations. As we say, there can be very large numbers. They can be actually difficult to track them all down. Then you have to begin by manually identifying some of the negative keywords that you want to be looking at, the things which people are saying about refugees. Then you develop an app to recognize these words in the local languages. And a lot of countries, there's quite a few local languages. So this is quite a technical challenge. Firstly, to be able to identify the language and then to be able to track the words in each of the languages. Then you need to do contextual analysis to produce the correct English translation. You can't just translate word by word. You have to understand the phrase. For example, HIV/AIDS in a local language might be the words of thin and hungry. So if you just do a search on hungry, you'll get all of the advertisements for different kinds of foods. If you do it on thin, you'll get advertisements for slimming programs. So you have to be able to do the contextual analysis to look at the two together. Then you run searches to identify programs with most of the keywords, and you use geolocation to identify the specific areas where you're getting a higher incidence of these negative comments about refugees. throughout, obviously, there are major ethical issues of security of data we have to be continually looking at. So these are beginning to be used in a number of UN programs in different countries. So some of the next steps which people are working on is identifying influencers. These are the people who generate and spread information to large audiences. Then you have to test, as various other colleagues have been mentioning, strategies for what do you actually do when you've identified these messages. And similar methodologies are already being used for identifying fake news and hate speech. I'd be happy to talk about that if we have some time. So just very quickly, what are some of the lessons which we're beginning to learn? Firstly, in terms of feasibility, these technologies are already being used by a large number of UN agencies. The next step is to, as various of our colleagues have already mentioned, to be developing and testing strategies to combat. What do you do when you've actually identified that a lot of people in a particular area of the country are saying, have you noticed since we've had all of these refugees coming in that crime has gone up, or there's more drugs are being sold? So an action plan to actually do something about the information, what you got it. In the medium term, you can use these technologies, the radio calling programs, to study any areas of community concern, farming, food, gender issues. So there's very wide applications. And one of the issues is at the moment, there tends not to be a very good gender analysis in a lot of these programs. You don't know who is calling in necessarily, and you don't look at the differences in attitudes of men and women. What are some of the constraints maybe on women's access to the media? Ethical informations, one of the things you need to think about, what are some of the unintended outcomes of collecting this kind of information? For example, if you show that a refugee integration program is not working well in a particular part of the country, what might be the action of the government? Maybe they will cut off that program because they only want to work on programs which are having success. So you have to be anticipating these kinds of issues. There's many more ethical issues I'd be more than happy to discuss. Data security is a really critical issue. The challenge of aggregating data so that it's not easy to identify particular people. This is a particular challenge with radio stations which only have a local coverage, so it becomes relatively easy to identify some of these. Then a particular challenge is when you're sharing information among different agencies which may have different security protocols. So the more agencies you're sharing information with, the bigger the risk of this information getting out. And a final point, which you'll come back to later if necessary, is that many agencies have an orientation of sharing information widely with other agencies. This is your philosophy. You develop a map, you share it with everybody. But when you start getting into very sensitive information, this becomes a big issue. For example, if there's an earthquake and you have a map of where people are moving to, unfortunately, the local mafia can use this information to go and start kidnapping young women. So you have to be aware you're entering into a very different field when you start sharing information on potentially sensitive topics. And I hope we'll have a chance to come back to that. Then finally, here's just a reference for one of the reports by UN Global Pulse, which gives an overview of some of the work they're doing with big data and artificial intelligence. So thank you very much.
Thank you, Michael. Thank you for this interesting presentation. And you've raised a lot of interesting questions about ethics, and I hope that that can also be raised during the breakout room. One of the questions we've received so far is if you could explain a bit the difference between the big data and social listening, and your experience with bringing all that together, particularly within your first slide. Thank you.
Okay. So should I just address that one question?
Go ahead and we'll see if we have more. Thank you.
Right, yeah. Big data is a generic term which covers all kinds of information, essentially, which often the definition is information which is too large to analyze on a typical office computer. So this can be any kind of data. The social listening can be big data. It doesn't have to be. Very often you find, for example, if you're looking at your individual maps, which were described, each individual map might not be considered big data. But when you start aggregating different kinds of maps, overlaying one on another, or where you start comparing maps over time, or where you link these maps to other sources of data, surveys which have been done, or information on areas of food insecurity, then it can become big data. So basically, it's the simplest definition is information where you need to have access to a larger computer system. So it often begins with many kinds of information which are not big, but which once you start aggregating over time, comparing different kinds of information, then it can become large.
Thank you, Michael. This will be the last question I think we can answer now, so we can go to the breakouts after this. But the question is, how are you using artificial intelligence?
Okay, that's
thank you.
Thank you. That's a question for a long session, but just one example of how artificial intelligence is being used when you have large data sets. For example, if you're combining surveys on health and unemployment with data from some of the programs, UN programs or NGOs which are operating in a particular area, you have a lot of different kinds of information, both on the conditions of communities and on different kinds of interventions. One of the exciting things which is being done with AI is to create what some people call natural experiments. If you have programs which are working in very large numbers of different communities, you may find there's a similar program which is being implemented in slightly different ways in different areas, or in the same way in areas which have different kind of characteristics, higher levels of unemployment, higher levels of people who don't have access to health programs. So you can match using AI so that you can find similar kinds of interventions in different parts of the population you're studying, and you can look at what are the different outcomes. So it's I noticed Anupam Anand is participating in this seminar, and the Global Environment Facility, they've used this a lot for example, looking at the effects of interventions to protect forests, where you can create a natural experiment where you match areas where there is an intervention with similar areas which there isn't, and you look at the difference in the outcome. So this is just one way where with AI, you can just begin to look for patterns in very large amounts of data, which was previously very difficult to do just because of the size of the data you're working with. So this is just one of the many ways that AI is starting to be used for creating natural experiments.
Thank you, Michael. I think we'll end there, and I'll pass on to Shravanti. Thanks again.
Okay, thank you so much, Michael. That was really very interesting. And again, we see sort of some connection, because even social listening and all three of these methods are using some kind of technology, and so they have that in common. And so that's a trend, I guess, going forward, that we're going to have to integrate more and more some of these new technologies in our work. So now we're going to move to the breakout rooms. In the interest of time, we're going to reduce, we had originally planned for 15 minutes, but we're going to reduce that to 10 minutes. So we have time for sort of a report back. So just very quickly, we will have a separate room for each method, where we'll have a facilitator from the Hague as well as a reporter taking notes on the discussion. And also the presenters will be in those rooms. So The focus will be to discuss the set of questions that we posed with the support and insight of the experts on that method. We ask that when you're in that room, you use the raise hand function to indicate you are interested to speak, and the moderator will call on you. At the end of the 10 minutes, you'll automatically be moved back into the main plenary, where we'll have a report back from the note takers of each of the breakout rooms, and then we'll have some time for overall final Q&A, and you have opportunity to ask further questions during that time. We'll also be randomly assigning you to the breakout rooms, but if you feel strongly that you would like to join a different room, you'll have about a minute or two to switch to that. I will hand over to Thomas, who will sort of explain a bit better how to do
Okay,
that.
thank you very much. I will just open the breakout rooms now. We have 3 rooms for the 3 topics here, and you don't have to do anything. You will be moved automatically. And if you want to move to a different room, just locate the breakout rooms icon at the bottom of your screen and then choose another topic where you want to engage in the discussion. Okay, I will open the rooms now, and after 10 minutes, you will be moved back to the plenary.
Okay, hello everyone. I hope you had a good discussion in the breakout room. I know the time was a bit shorter than what we anticipated. I was in the big data one, we were able to get in some questions and touch on some additional topics that we weren't able to do so after the Q&A for the presentation. I really wanted to sort of hand over now to the reporters to sort of give a bit of a flavor on what was discussed in each of the 3 breakout rooms. Maybe we can start with Monica on social listening. If you could just give us a brief recap, maybe 2 minutes.
Hi, colleagues. Can you hear me?
We can hear you.
Okay. So with regard to the social listening group, we discussed 3 key questions, and one of them was to do with what to do with lots of social media and issues about access in view of network issues in different communities. And the response was that usually this is context specific, and there are also different tools which can be used in different places, and also that there are different platforms which allow tracking. For example, I think the talk walker was discussed extensively during the presentation. And then that there are also different tools which can also be used to track information on Facebook or Instagram. So basically there are different types of tools and different platforms which can actually be used to be able to access the different locations. And then there was a question to do with implications for humanitarian. Unfortunately, we didn't get to share the information from colleagues, but Sylvia was noting that most of the information which is currently used in the region where she's working is that it's being used to inform communication for development in order to respond to the social needs. And she also mentioned that there are certain countries, for example, Kenya was given as an example, where they using the information to track some indicators. But at the moment, not much has been used for humanitarian evaluation. And the other question, which maybe relates to issues around ethical issues, was about fake news, how to make sure that the information, is it true or is it not? And apparently there are different tools which are available to check whether information is true or not. And I think within the region, they have a regional alliance, which they also work with to verify information. And at the moment, there are also plans to build the capacity of the organizations for them to be able to identify whether the information which is being posted is true or not. I think this is it. There was a last question which unfortunately she could not respond because of the time. Maybe if she's able to respond to it at the moment, but this is what we discussed in our group. Thank you, and over.
Thank you so much, Monica, for sharing that. I'd like to hand over to Paul, who could just give us a brief, like 1 or 2 minute recap on what was discussed in the citizen-generated data room.
Sure. We started out by discussing how citizens-generated data fits within context operationally and within evaluations. So the discussion touched upon how organizations like HOT can connect with organizations that are conducting evaluations, and how do organizations accommodate HOT into their own research design and delivery. While organizations might be interested in using different types of data, HOT is interested in opening up discussions to other types of partners and other needs. And then we discussed the applicability of a platform like HOT within more development contexts. In other words, how can we prepare in advance of an emergency? And there were several examples that we discussed how, for example, in the Nepal earthquake, there was already a team in place that allowed the mapping activities there to be scaled up quite quickly. That was for the Nepal earthquake. There's currently a large team for the COVID response, and in particular, comparisons of pre-disaster and post-disaster conditions are particularly effective if there are teams in place already. We then provided some concrete examples and scenarios from different contexts. One was DRC, looking at participatory mobility mapping. We touched on how mapping is sometimes how affected by boundaries and political issues. And then finally, we discussed how citizen-generated data extends beyond mapping. It could be useful, for example, in SGD monitoring, and there is a preliminary guide that has been generated in a community of practitioners on how to use citizen-generated data, but we were cut off towards the end when we started to discuss that. Over.
Okay, thank you so much, Paul. And there's really a lot more to discuss, I think, on all of these methods that this session isn't allowing for sort of that more in-depth discussion, but at least hopefully it gives us an introduction to these new methods. I wanted to hand over to Mari, so she could give us a report back from the big data room, and then we can have a sort of overall sort of wrap-up discussion.
Thank you, Shravanti. The big data room started with an excellent example from FAO using the GIS and satellite images to track the vegetation and irrigation channels, which is called the open forest tools. Maybe if your colleagues could put in the correct name in the chat box based on the Google Earth. And then responding to the question on how we can correct the data on the refugee integration to the host communities. We got the information that there is a very good book on such technologies, and then hopefully we can get the link to that book. And at the same time, the collecting from data, there is a sensitivity around it, and then the government restriction might be expected, and also like how to control those data needs extra care, because this could be the and then, I mean, they expose some people to the risk. On the same note, there is a question on like how we can collect the big data, for example, in armed conflict context, that might expose the collaborators to the risk, but then the discussion didn't go further because of the time constraints. At the same time, there is the question and the discussion on the access to the big data by like civil societies and NGOs, and then because there's an impression that there is the capacity and then cost incurred to access to big data. So the developing partnerships among those the stakeholders is quite crucial to deal with big data, which is discussed, and then also the challenges, which is right that technology developed sometimes, not always, not necessarily always, but without local or civil society's feedback into those technologies is raised as a caveat. As a practical implication, many evaluators haven't been familiarized with the use of big data, so there is still skepticism remains. At the same time, there is the use in assessment or like program design, so that we can still, there is a room that we can explore in the near future. Over to you, Shravanti.
Okay, thank you so much, Mari, for that sort of recap of what was discussed in the big data session. We wanted to sort of do just like a final Q&A across the board. Unfortunately, Angus and Sylvia have had to leave because they had other meetings. So they will, so they send their regrets. And Rebecca Firth also had to leave. But I understand Lauren is still from HOT is still online with us, so hopefully she should be able to answer some questions, as well as Michael Bamberger. So I'm going to hand over to Diana to see if there are any other, so she can moderate if there are any other questions from the chat group. If you have any other questions, we can take a few minutes to try to answer those.
Yeah, so far I don't see any.
Okay. Maybe
I know that several, Sylvia has put in her email, and potentially we can add more in case people want to link up. And then Cedar offered the FAO link as well, but I don't see any other questions.
Okay, well, maybe we can see if Michael and Lauren would like to make a last closing comment before we sort of do a quick poll, and we have a Survey Monkey just to get your feedback on the experience. So I know we're just over 10:30, but if you could, I see there's still many people still connected. If you could stay with us for another about 5 minutes. But I also just wanted to, maybe Michael, if there's anything else you wanted to add, if you had a minute, like a closing comment or remark.
Sure. So first, I very much enjoyed this session, and a lot of interesting ideas have come up. The message I would like to leave is that many people are beginning to use big data, but you find most agencies only use a very limited range of big data. They're experts in mapping or in certain kinds of social media analysis, but there are many other potentially useful tools which are very often not being exploited. So I think specifically in the humanitarian field, it would be interesting to think of setting up some kind of mechanism for either some basic capacity development or sharing experiences, just so that agencies can begin to think of a range of other kinds of big data which they potentially could use and which they're not using, and to draw upon the tremendous expertise of the group to share with each other. So it's not having to reinvent the wheel, but for example, many organizations are not using some of these mapping technologies at the moment, but there's many people in this group who've got the expertise to help share. So I think there's just a tremendous potential for broadening the use of big data. And at the same time, just to remind ourselves, it's not a magical panacea. Big data is good at doing some things. It has some fundamental issues and limitations often. So it's one set of tools among others, but it's not going to solve all of our problems. But I think there is just a very exciting opportunities for expanding the use of big data.
Thank you, Michael. I wanted to hand over to Lauren from HOT, so she could say a few final words.
Yeah, just very quickly, and echoing similar, that citizen-generated data is really quite a new thing in evaluation, and I think the potential is huge. And in particular, in our group, we touched on the use of OSM, OpenStreetMap, in SDG monitoring, not just within mapping in particular countries and in particular areas where evaluations take place. So I think the scope is something I'd really like people to take away, and that the level of partnerships in evaluation that we would like to take forward. And then finally, with OpenStreetMap, we're also very much centered on capacity strengthening of GIS and within that evaluation. So the ownership of evaluations in using OpenStreetMap as we move forward also has huge potential. So thank you everyone for listening to us. It's been a great session. That's it from me.
Okay, well, we really wanted to thank the presenters, all of them, because I think this really helped to introduce us to some new methods that we need to start considering how we could use it. And really, I like the point of that we can create new partnerships. And hopefully that's something that comes out of this discussion, that people will start to look at these different methods, reach out to the presenters, these organizations, as well as think about what we need, what kind of skills we need as evaluators, not to be, there's a lot of new technology that we're not always so comfortable with, but I think there is so much potential in some of these methods that are being used in other ways that we really can sort of harness to make our evaluations better, regardless of the context. And I think one key point that came across, I think in all three of them, that I would just wanted to make a comment on is the way in which the citizens, the participants are in social listening. We heard that it was so important to, even though you're doing that listening without sort of the knowledge of the people, but engaging those people in the analysis and in the use of that data is very important. When we look at citizen-generated data, that's so, it's such a participatory way to collect that information. And that's something we're always trying to increase in our evaluations, especially within the UN system. And I think big data, it's a bit more sort of at a higher macro level, collecting this data, but it does have a lot of implications in terms of sort of the people and the participants, and sort of opens up sort of the ethical issues. And I see sort of different ways in which all three of these methods sort of can interconnect with each other and can be used in evaluation. And so I hope that that's something that you've also taken some sort of new insights or reflections away from this session as well. We wanted to get your quick feedback. We have a poll that we'd like to sort of put up right now, and just to take a minute for this. We have two questions at the conclusion of this EPE. Do you see the potential to apply any of these tools in your work, any of these methods? And also, if you said yes, then which one do you think is most feasible for using in the evaluations that you do? So I think we see 75, 80% are saying yes for some of them, and 22% are saying yes for most of them. The ones that seem, big data seems to be the most feasible one with 69%, but really not that far behind is social listening data, 54. Well, it just changed to, it's constantly changing here. But we see about 50% or over 50% for all three of the methods. And I think that's a really good sign that these are sort of methods that we need to look into and see how to integrate them into our evaluation toolbox. We are going to share in the chat a SurveyMonkey link, a survey a link to SurveyMonkey to do a final survey on this session. We'd really appreciate your feedback. If we're planning other ones, we'd like to improve, and we really want to know how you found the session. And then finally, if you want to learn more about these, we've just put some resources up on each of the 3 methods. Of course, there's many more resources, but we have Angus shared a case study from Pakistan, which is a YouTube video, so you can listen to that. And then also there's some social listening tools, you know, a little bit more practical, and you can consider how those tools might be useful for you. So please take a look at that. We've shared HOT's website, where I think they have a lot more information, as well as the citizen-generated data task force that is looking at how to use citizen-generated data for the SDGs. So I think that's might be relevant for a lot of you. We have the resource that Michael shared on big data. That I think is going to be very interesting to look at, and we'll have a lot of useful information. And then I also shared a feasibility study that we did at UN Women on if that big data can be used for evaluation, really looking more at social media. So you might be interested to take a look at that as well. I want to thank you all again for staying with us until the end and bearing with us for any technical issues. And thank you again to the presenters, to all the HYPE members that were instrumental in putting this session together and implementing it, as well as the EPE organizers. Thank you all very much.